Hey everyone, this is Dr. Scott Gray from scottgraypt.com. And so today I want to talk to you guys about the top 5 questions you should be asking your lower back pain patients. And you probably should be asking all your patients this who have musculoskeletal pathologies because it will allow you to get better treatment. And so I want to tell you a little story before we get started. So initially right out of PT school, I thought I was this rock star PT. I thought I could get everyone better, and especially lower back pain patients coming from a school that was highly trained in that. And so I started treating a lot of patients, and I started realizing I made a lot of mistakes. And so one of them was asking my patients the wrong questions in the subjective evaluation. And so with the subjective evaluation, you really can pinpoint, what the potential diagnosis might be. You can rule out others, but you can really kind of extrapolate what's going to make this patient feel better and or worse. And so I really have 5 questions here that I'd like to talk with you. So the first one you need to ask all patients is your pain constant? And so what I mean by that is throughout the day, 24 hours, 7 days a week, is your pain constant? And you need to clarify that, because a lot of times patients say, oh yeah, Dr. Gray, my pain is constant. But you start digging deeper, they don't have pain when they're sleeping. And so this is important because constant pain usually is 2 things. So it is an inflammatory or chemical pain, or it is a chronic pain. So chronic pain stems from the brain, top down. So when they say yes, you might want to then address the brain side of things after you ruled out that it's not chemical. Similarly, chemical pain can be constant. So if they have swelling and inflammation, that pain is going to be constant all the time. So think of your patients who've had surgery. They have chemical pain, and obviously they have trauma, but they have inflammation going on. The second thing you need to ask your patient, what makes it better and what makes it worse? So typically with spine patients, they'll tell you that it hurts when they're sitting at their desk all day, or they might say that it hurts standing. So if it hurts when they're sitting at their desk, I'm probably going to address the way they're sitting. Conversely, if it is something when they're walking, I'm thinking more biomechanics, maybe some core weakness, limited hip mobility, thoracic spine mobility. So that kind of helps, again, kind of where you need to go with your treatment. The third thing you need to be aware of and ask your patients the time of day. So if a patient has some swelling and inflammation as well, they can have pain in the evening and early first thing in the morning. Similarly with patients who have OA or degenerative disc disease, they'll have pain first thing in the morning, but then as they start moving their spine and getting fluid in the facet joints, they feel better. The third or fourth thing you need to ask your patients, do they have numbness and tingling? So if they have numbness and tingling, you can be thinking it might be sciatica, neural tension, nerve entrapment, or a disc. And so you want to rule those things out with your structural examination. If they don't have numbness and tingling or weakness and that sort of thing, you don't really need to go down that route with your neuro exam. You could probably just do your standard examination, whether it be McKenzie, SFMA, whatever you do, to kind of help rule out other pathologies. And then the last thing you need to ask your patients is their views on their pain. So a lot of times I have found throughout clinical practice, patients get better regardless of typically what you do if they have a good view or outlook on their pain. If they have a negative view, such as that they don't think that they can get better, these are yellow flags and red flags, and you need to address those first thing before you even get into is it a disc, is it the facet joints, because you need to change their mindset. So there you have it. Those are the 5 questions you need to ask all your lower back pain patients.